Greg Stanley. I'm here with Wes Warren. We work at Whitehall Management. Today, we'd like to talk about 3 incredible ideas to allow a practice to increase by at least $25,000 a month and to do it in 30 days. Now, I know some of you hearing this think this is probably over the top, but we see it all the time. Wes, tell us what you've learned.
Yeah, a lot of practices are underproducing, quite frankly. There's room to improve, and you know it. And you wouldn't be listening to this if you didn't feel like that was possible. If you were full to the brim and you're booked out 3 or 4 weeks, and basically there is no room for improvement, you know, none of this stuff's going to work. You have a capacity blockage. And to be fair, improving these things or fixing these things will only, all it's going to do is put you out another 4 weeks, but it's not really going to fix the core issue. I want to be clear that if you've got a capacity blockage, that's what's got to be fixed first.
Okay.
And so if your schedule is booked out 2 or 3 weeks consistently, nothing is going to help you because you already are full. Okay. But for those of you that are listening, you're probably in a situation where you've got openings, you can improve, and you just don't know what's wrong, and you're looking for ideas on how to fix it. So that's kind of what I want to just establish first. There are a ton of ways to grow a practice. We're going to cover 3 of our top ways. When we consult with people, these are the quickest and cheapest and most effective ways to grow a practice very quickly overnight. And number 1, Greg, that we consistently see this happen is with same-day service. Same-day service. You've probably heard that before. You may have even heard us talk about it before. Same-day service is essentially when you see something in hygiene, you diagnose something in hygiene. This is not diagnosing an emergency patient that comes in and doing treatment on them. That, I would say, doesn't really count. It's kind of implied that we're going to try to do something for you. This is when you see treatment in hygiene and when you see treatment with the comprehensive exam with a new patient.
Somebody's going to ask, Wes, well, what if I have people on the book already and there's somebody back there willing to accept dentistry?
Here's the secret. Here's the thing that makes this all work. This is why we see a huge increase in a practice when they really take this and really try to implement it, is if you could actually offer every patient that walks through the door in hygiene and new patients that, hey, we might have time to get that done right now. Would you like to get that done right now? It increases case acceptance by at least 50%. The likelihood of somebody saying, yeah, let's just do it, goes sky high because we're such a convenience society. And we just want to get it over with. We want to do it right now. They'll call in and cancel the rest of their day at work, and they'll just get it done. And so case acceptance verifiably goes up around 50%. And that's really the secret. The problem is what you just said, is that we've got patients, we're kind of full, almost full. And that opening that we need to fill is a little later. It's not right now. It doesn't line up with our schedule. And so we say to the patient, maybe, hey, can you come back in 3 hours? And the patient says, well, no, and they kind of drift off. Or you say, well, we got an opening tomorrow. Would you come back tomorrow and fill that opening? And again, case acceptance is definitely impaired when you can't do it right then when it's diagnosed.
I agree. One of the problems we run into is, we're talking about same-day service. In a way, we're actually making more work for staff. In other words, more work and more tension.
Yeah.
In other words, they have to go back and buy time with the people that have already scheduled or sitting in the chair and having to wait. The weight kind of falls on them. And they also have to figure out how to get this person in. So unless the staff are somehow made to see this differently, it's really a fight.
Well, this is the problem. Like you said, the staff are highly tuned to patients being upset, especially with waiting. I mean, they hear about it from the patient. The doctor really doesn't. The staff has to hear about it, has to know that somebody's getting angry sitting out there and waiting, or somebody's sitting in the chair waiting for the doctor. They're the ones that take the sometimes it's nonverbal abuse as far as somebody waiting, and they don't like it. They hate it. And so they're not going to squeeze somebody in. They're just not going to do it under almost any circumstance. And what you've got to do is really get the team to really see that as a good thing, and to see it as somebody, yeah, they wait sometimes. Yep, we run behind sometimes, and it's okay. We're trying to squeeze everybody in, and we run behind, yeah, 20 minutes, 25 minutes. It's, and they kind of try to smooth it over with everybody, and not really slow down the schedule. Literally, if you're running behind 25, 30 minutes every day, your team will consciously slow the practice down. They'll consciously pad the schedule, and they'll consciously produce less, because they don't want to deal with angry patients that are upset.
With patients that are upset because they had to wait a little longer as we worked somebody in, some doctors have done very well by giving away a gift card for $10 or $15 to Starbucks or a restaurant or something, and all is forgiven. And so we got the opportunities in sitting in one chair, the hygiene chair, to come and fill up a chair that's already full. We know that's a stressor. However, if you take what we've learned, number one, if you can do something for that patient that's already there with an appointment and compensate them, it doesn't take very much. It's nothing compared to what you'll make by doing both patients over a longer period of time.
Right.
And two, helping the staff see this. And this can be done by sitting them down and explaining to them what we've learned at Whitehall. We've learned that a patient that is sitting in the chair and has shown some new dentistry, their odds of getting it done skyrocket if they can get it done while they're sitting there. And the other has something to do with what we're going to cover next.
The next thing, and this is probably, it goes hand in hand with same day service. In other words, this whole idea, this concept, you probably sit there and go, yeah, I get it. Yeah, we really need to start squeezing people in. I just can't get my team around it, can't get them to buy into it fully. Really, the next step is bonus systems and incentivizing a team. We've done bonuses, and we've done monthly bonuses and goals for the month, and if we hit these certain numbers, and it's weak. A lot of you have tried it and you realize that it has little effect. Maybe it works for a month or two, and then it kind of just fades away because it's some nebulous goal that is arbitrary, and there's a lot of factors that either make them hit it or not hit it. That's out of their control. And so it just kind of becomes a given or an entitlement even, or just kind of like, hey, we never get it anyways.
A doctor left to themselves will throw in enough qualifiers to protect himself that staff probably don't get the bonus unless it's almost an accident.
Right.
And so a real living daily bonus is what you're saying. If today turns out the way it could, based on what we know about same day service, people calling in who can get in same day. In other words, staff get a bonus based on just keeping their eyes and ears open for production. You'd be amazed what they spot. People call in with a question. Maybe it's a new patient. Maybe it's not even a patient. Staff that are incentivized have ways to get those people in and sitting in the dental chair to get treatment.
It is shocking,
yeah,
to be honest, what they can do.
It's a wonder, why weren't they doing this before? Well, we hadn't really tuned them in for what's in it for them.
They were protecting kind of the patients and not really protecting the overhead and the production of the practice and maximizing every opportunity. That's just not how they saw it. And when you really get this right, you'll know it. When you get the team truly incentivized and where they really start to see the day, every opportunity as it's like their life depends on it, all of a sudden you'll be like, hey, you're going to want to put the brakes on, because you're going to be working through lunch most of the time.
Right.
And you're not going to get breaks. They're going to pull you out of your office. If you like to play on the computer and things like that, they're going to get very upset and want to drag you out. And that's what you're wanting to see from them. It's exactly the behavior that you're looking for. And like Greg, you were saying, it's got to be daily. We even have, as a lot of you know, bonuses just for the event, meaning if you get this person to stay, and if the team actually works them in, the person that asked them to stay and the person that works them in get a bonus, meaning the hygienist might be the one that really tries to get them to stay and tries to convince them to get it done. And then we also incentivize the assistant that actually works them in.
You know, we can find a lot of same-day service that we weren't doing before. It's an incredible breakthrough for a practice. But if it's going to an associate doctor, a lot of times his or her skills are underdeveloped. They cannot treat quickly. So normally a regular doctor, an owner, in the time he or she is anesthetizing while a person is numbing up, somebody can go in and get something started. If there's another chair, making same day very doable. It takes an incredible staff, motivated, incentivized to be able to pull these things off with associates. Associates are where you're more likely to end up giving the gift cards and having the staff doing a little tap dance, try to buy time. But these two things we've talked about, we talked about same-day service, talked about bonuses. These two things can add $25,000 to a practice, and doctors are terrified of both of these. One, what's it going to cost me in staff bonuses? Is this going to get out of control? And number two, is my workload going to get out of control? Well, you can manage both of these. Don't worry, the staff bonus, you turn it up enough that they come to life, it'll be fine. It all works out fine. We typically spend about 4 to 5% max of what we produce from bonus treatment to get it done. So don't worry about that. Same day service, you get staff bonus, they'll work it in, and with these gift cards, they'll make everybody happy. Wes, have you got a third way?
The next is, and it's kind of a big one for a lot of offices, it's probably can be the most impactful. And it's getting the correct case size, Greg. When you're dealing with patients, obviously, if you go too big, meaning you present too much treatment, you don't get patients walk out and do a little piece of it. What happens is they walk out and do none of it. And then, of course, if you ask them to do too little, you're watching a lot of teeth and you're really not diagnosing what you probably should, fillings and stuff, when it should be a crown. And so you're too little. Obviously, that has an impact.
Underproduce.
Yeah, right. You're underproducing, and it does take a lot more time to produce these smaller cases. And so getting the correct case size is, I would say, critical for, in my consulting experiences with doctors, I would say about 70–80% of the time, it's a huge factor of what's causing the office to underproduce restoratively. Okay, and so I want to give you guys some real data that you can take home and actually evaluate how you're doing with case size. I want you to do it on new patients, because this will be the best indicator of how you're doing. You should track your new patient's case acceptance. So if you got, let's say, 10 new patients, we'll keep the numbers real simple. You should get around 80%, so 8 out of 10 to accept something restoratively, and 2 go home and think about it on the first visit, meaning just sat down with these 10 new patients. 8 said, I want to do it, sign me up, let's pick a date, and they're in the schedule. You might not have paid for it, but they're booked. And we know that there's a high chance they're going to actually get it done. And there should only be 2 that actually walk out and say, let me think about it, let me talk to my wife, let me call you back, I want to do it, but I'll have to call you back. Okay, so you should have very high case acceptance in terms of the percentage. But then the average dollar amount should be around $1,000 on average per patient seen. So if you saw 10 patients, you should see $10,000 worth of dentistry. 2 say no, 8 say yes. The 8 say yes, you produce $10,000 off of them. That's a minimum. That's what you should be shooting for. And if your numbers are way different than that, meaning, okay, I only close 40%, but I get 8,000 or I get 6,000, that would be an indication that you're probably presenting a little too much. You're getting a lot from a few people, but you're alienating the rest of the people. And so you got to be careful of that. And then, of course, if you are getting 8 out of 10, but you're only getting $500 on average, that would be an indication that maybe you're being a little too conservative. And these are national averages. So when we go around the country and do these kind of things, you got to keep in mind it can go up or down by around 20%. So if your fees in your area is a little depressed, yes, it might be 800. If you're in a really nice area, that number might be 1,200. But it's going to be you'd be shocked. It's very consistent, right in around that number.
Just a thought too. When we try to get all that's gettable, that includes not leaving a patient feeling overwhelmed, even though they accept it, to the point they would not refer.
Yeah.
So when we say get it right, we have that taken into account.
What I tend to see, when I track this and I've done this for years now. So when I look at these numbers, what I'll see is with new patients, phase 1, meaning, yeah, we found a bunch of dentistry, but in terms of phase 1, what we sit down and ask them to do, I typically will see, between $600 and $1,600 or $1,800 presented, with an average of, $1,200, $1,300, and you kind of get that $1,000 average. That's what I see when I see doctors, presenting $2,200, $2,800, $3,400, and it's just case after case down the list. We start to see a few too many goose eggs that really drive down case acceptance.
This is a tough thing because associate doctors struggle with this idea. Do I show everything I see or don't I? Am I or am I not?
Yeah, you get into this whole concept of, is this, supervised neglect? Am I doing something wrong here? And I do agree. You should tell the patients what you think is the right thing to do. But you also should say, let's get, if I were you in your situation, there's a couple things I would do right away. And let's get started here. You can use language like, in a perfect world, you should get all this taken care of. All this stuff could fail at any point. And I'm using my best educated guess through years of doing this. But technically, any of this stuff could fail. And so we have to make choices. And a lot of times those choices are based on budgets. People live inside a budget. And if that's the case, that if you have to work inside a budget, there's one tooth I wouldn't wait on. So you can phrase it in a way that you're still ethically sound. Let's put it that way.
We all know that once a patient accepts something, gets it done, was very comfortable during the process, paid for it, didn't feel pushed, the odds of them coming back and getting the rest of the work done really go way up versus having them just disappear.
That's the problem. When you get goose eggs on new patients, they disappear quietly in the night.
Some doctors comfort themselves saying, oh, they'll be back. But maybe if you look at do a look back study, maybe they're not coming back.
Good point. So we typically will ask doctors to do this look back study. Take a batch of new patients you saw 13 months ago or 14 months ago and see how many of them have come back for the recall exam, which should have happened by now is the point. And take a look at the percentage that have an appointment in the practice. Some practices it's 40%, 50%, 60%. We'll see that a lot, which is not terribly good. We're losing half the people by the time a year's up. But too many offices, and when I say too many, at least a third the number is some embarrassing number of like 20%.
Okay, and I'm going to call this right sizing. This probably comes from some other area of the news or something, but getting it right where they'll refer, but they buy enough dentistry, they'll come back, they don't buy too much. You can benefit and learn quickly by asking your most respected chairside what they think about this person. Did I show them too much? Did I show them too little? Staff are very good at reading people in some ways because they're one of them.
I want to make a comment about that because it's a good point. What we're talking about here is what we call unexpected dentistry. These are patients that by and large don't really think they need a bunch. They came in maybe with a little something, but you saw a lot and they really aren't really quite aware that they needed so much dental work. People that come in fully aware and that it's very obvious to them and they know it, these are not the cases we're talking about. With them, you can be brutally honest, and they know it. They already know they have a problem. It's really just financial at that point, and you just let them know. Look, we'll take it at the pace that you're comfortable and the speed that you can afford. But yeah, you got a lot of stuff going on here, and you got to take care of it as soon as you can, as quick as you can. In those cases, you can be more direct and straightforward, but it should be very obvious, not to you, but to the patient is the point.
I want to go back on these three and say, and first of all, we back our guarantee. These will definitely boost you 25,000. I'd like to know why you think most doctors find these so hard to conquer.
So the first one, same day service. First, it's mentally deciding like, okay, you're right. This could actually, if I offered this to everybody, and we could actually squeeze them in, yes, it would increase the practice. And you have to buy into that concept. Then you also have to get the team to buy into that. They have to believe that as well. And unfortunately, the majority of your team kind of, especially assistants, kind of overworked. They're running at a pace that's pretty, in most offices, pretty high rate. With assistants, you've got one. If you're lucky, you got two really good assistants. And so you're usually leaning on them too much. And so they kind of, hey, and they give front desk the evil eye when they overload them. And so you get this whole, pushback from the restorative team at the front. And then the front gets the evil eye from the patient waiting, and this whole thing just stops. You don't get this motivated team who's willing to double time it, to work with the patients, work with the schedule, and fit it in. That's where it all dies.
When a doctor hears a respected staff person say, "This isn't working, doctor," or this isn't fair to people, or say something, so a lot of doctors, they feel like they've touched the hot stove. They don't go there again. But there's a few things like you're talking about. Get the bonus going, get everybody informed on how it's done, and go forward with it.
You typically got to prime the pump. What I've noticed is kind of like a ball in motion tends to stay in motion. Once you prime the pump, the water flows, and it will continue to flow. You've got to get the team to change its culture of how we do things. And bonus is a big driver of that. And what you can do is be over generous in the beginning, get it and do things that are, I'll say, outrageous, but where you let them know, like the first 5 cases we get, it's double. And then it goes back down to regular bonuses after the first 5, so that they get really pumped up and really motivated for the first 5 of the month. And it tends, after a little while, you can start to see the chugging going and the change in culture, because that's what it takes. And what's funny is with this is after you kind of get this going, you can lose team members, new team members come in and they just go, okay, this is how we do things. And then you can almost retract the bonus down to embarrassingly low levels. And it's still, the machine still chugs, but you got to be over generous in the beginning for sure.
I've had doctors tell me that they fantasize about a schedule booked out several months in advance. They sleep better at night. It's reassuring. When you start grabbing all of this treatment because you need it, you want it, and because patients think it's great to do it right now, it could leave you with a day of reckoning, a day coming when there's nobody in the practice. Any thoughts on that?
So yeah, I've heard this a few times where they're a little scared, like if we're getting all this treatment, and it does happen. So this whole idea, of your schedule being booked out 2 weeks or 3 weeks, that's dentistry that should have been done within a day or two, to be honest. It's like waking up at the beginning of the month and looking at your new patient schedule for the month of June, and it's already booked, and being like, good. I go, no, those new patients should have been seen in May. They called in May. Why didn't you get them in May? And that's kind of the logic that you're using here. It's not sound logic.
I would also go on to the number 2, bonus. One of the fears doctors have is it being unfair. Somebody gets a patient same date or brings them in on the phone or does some heroic thing and gets a bonus for it. And the other people sometimes have a little trouble adjusting to why she's doing so well, why she's getting bonus, and also a lot of accolades. You want to comment on that?
It's kind of one of those things where you've got to let the team, and you've got to be kind of stern on this, is to kind of get over it. This is just the way we're doing it. And it can't be perfect. There's just no way to make it perfect. It's impossible. Bonus, we touched on a bonus, and this is the daily bonus. Instead of doing a monthly bonus, you should do a daily bonus, where when you start the day off and you have 5,000 on the books, you say, okay, if we get to 6,500, there's a bonus for the day that we share as a team. And we add it up for the month. And at the end of the month, I pay it into your salaries. And you should set this up to where they're getting it at least 25% of the time to 40% of the time, where they're getting it at least a couple times a week is the idea. That you're setting up the threshold where they're able to push and attain this bonus a couple times a week. And this is definitely, that bonus right there is definitely worth implementing to get, because it is a huge factor. And
I like your idea of also get over it. Okay, and number 3, right sizing your case presentation to get it just right where, and remember, just right isn't right in the middle. It's also how much a patient will buy and still refer a wife or husband or a friend. One of the things that I've learned over the time is having cases pre-assessed, staff letting me know what somebody's ready for, having them probe the person to see if they are aware of what they need. And if they accept that they really need it, and you're very gentle with your go forward, I believe you can achieve right sizing and begin to improve your case acceptance, Wes, I've seen prosthodontists. These guys do work that's so beautiful, it should be in a museum. And yet they get 10 out of 10 new patients that buy nothing. There's no doubt about what happened there. They were shown too much. Right. And it's very humbling for a prosthodontist a lot of times to go back and start where they get people saying yes. It's so often with 1 or 2 teeth, unless they were referred strongly by another dentist. It's a 1 or 2 teeth. It's kind of those numbers you talked about. So I would say that if anybody doubts, go back and listen. It was all here. $25,000 of improvement in 60 days if you can master these 3 ideas.
Absolutely. Yep.
All right. Thanks for listening.
Yep. Absolutely. Thanks for listening.